I'm here with Dr. Katie Carter, who runs a clinic out of Polson, Montana. She's been practicing for 25 years, I believe. We'll talk a lot about her practice and how she got into naturopathic medicine. And she has greatly given me about an hour of her time to talk about some interesting cases and also just some other things about naturopathic medicine and her practice. So, big welcome for Dr. Katie Carter. Thank you for being here with me.
Thank you.
I actually precepted with Dr. Carter for about a week this summer, and it was really a pretty amazing experience. Saw some really interesting cases. So, Dr. Carter, you practice out of Polson, Montana. What is the name of your practice?
Mission Healing Arts.
Mission Healing Arts. Now, how did you end up in Polson, which is a pretty small town?
Well, I when I left National in '86 when I graduated and took the first year that we had the MCATs, is that what the board exams? The first year that they had those, I passed that, and I went to Michigan and practiced for 5 years in an unlicensed state, and got the feeling of that, and wanted to come back to a licensed state, and I was checking out a couple practices in Washington and Oregon, and went to see my friend in Missoula, and decided to stay in Missoula with her. And then met my husband, and we decided we wanted to live in a smaller town where the air was a little fresher, and
Mm-hmm.
beautiful place that I've ever lived, right here on the Flathead Lake. So we decided that this was a community that we wanted to settle down in. And I also didn't really want a really big practice. Really, really busy because I was wanted to raise some kids.
Mm-hmm.
So kind of thought that a smaller community would be better. And I like smaller communities. I like the intimacy that they provide.
Yeah, yeah. You really get to kind of know the people, and yeah, it's definitely a lot more intimate. What are some of the you know I can imagine going when you go into a big city like Seattle or somewhere, you have just what's potentially this massive patient base, but you go into a small town like Polson, and how did you go about establishing your practice? Like, so you hung out your shingle, and then what? Did you do a lot of advertising? Did you try and network? Like, and how long did it take? How long did
Well,
it take before you felt busy?
actually, we moved here when I was pregnant. So it was really word of mouth at that point, and I was working 2 half days. And so it wasn't really a real busy practice at the beginning. And it wasn't really until my kids were in school that I practiced 4 days a week. Um,
Sure.
and that's what I'm practicing now is 4 days a week. And it's times during that time I was practicing 3 days a week. And if you're in a smaller town and the mortgages are cheaper and that kind of thing, then you can actually get away with not practicing as much because you don't have as many, the cost of living there isn't as much as a big city. So
Absolutely.
so it's kind of a way of life too.
And you've also, I'll just tell them a little bit about the way your clinic's set up. So you're downtown, but you're not like main drag downtown. So I'm guessing that choice is made because your rent would be a little bit cheaper, and then also you share the space with your husband, and that saves you a little bit of money too. Was that all intentional? I mean, did you go in getting that space with your husband thinking it would be cheaper that way? Um,
What we did is we bought a church, and because it was really beautiful, and we live in the Mission Valley, and the church is a mission style church, and so we just really liked it, and we had got a really good price on it 20 years or 18 years ago.
hmm
So we bought it and we gutted it out and redid the whole thing. It took us about a year to build it, and the Mission Valley is where we live, so we called it Mission Healing Arts. He's a therapist, and so yeah, it definitely was an inexpensive way to create our practice.
Yeah, it's a neat building too, and it's downtown, so it's a good central location for all those Polson patients and elsewhere that you see. So yeah, good place. Um, let's see what else here. So you started practicing. Your kids were young. Your kids are older now too. How long have you been practicing in Polson?
20 years.
About 20 years in Polson. That's a long time. Um, I know you said initially when you started there, when we talked about this before, like the medical doctors really. What was what was your relationship early on with the medical doctors, and how has that changed?
Well, that was the year actually in that April of 1991 was when we got our law, when we actually were licensed. So no medical doctor in Polson, Montana knew what a naturopath was or a pharmacist. And so when I first moved here, my relationships wasn't very friendly when I would call them to talk about a case or to make a referral. It was often rude, kind of rudeness in the labs of the hospital. I had to get it. I had to go through the head of the hospital to get it okayed that I use their lab and those kinds of things because I didn't have hospital privileges. And the lab people thought I was very strange and witchcraft kind of. But now it's been wonderful to slowly feel the transition of respect
That's
that
a,
I receive. And when I call a lab up and or the medical records at a hospital and say, "Hey, I have so and so in my office. We need to see their last CBC. Somehow it didn't get through, or maybe they saw another physician and they had run a CBC, or maybe somebody came in and they had been in the emergency room and I needed their lab." They just say, "Oh, hi, how you doing, Dr. Katie?" And it's very friendly. And the same with the pharmacists. They are so helpful to me now. And
that's
so
awesome.
it's really I feel like I've been in the trenches and I've
Yeah,
transforming our image in the world and in that respect and with the professionals. But I also feel like I've been in the trenches in terms of educating patients and of the citizens at large, in terms of how to take care of themselves and that the body has the ability to heal itself and the deep desire to do so. And we need to get out of the way and give it things that will support that. And it's been very rewarding career.
awesome. It sounds like it. It sounds like it. And early on, how did you how did you keep from taking all that sort of um, because there's only 16 maybe yeah there's 16 states that are licensed now, so a lot of people are going to face what you faced as these other states start to turn, or there's struggles elsewhere too. So how did you keep from um, let's see, how did you keep from feeling, how did you keep from taking all that personally, when you were looked at as a witch doctor, um, just because you knew that you knew inside you that you were right? I mean, was it what kind of carried you through that negativity?
I would like to say that I don't have an ego and that it didn't matter, but I did feel sort of a sadness or a hurt of some sort that I would observe myself starting to take it personally. But the main thing is every day focusing on my patients and
Mhm.
focusing on that part of it. And the other part it just became like water under a bridge. You just kind of watch it go through and you don't stay focused on it and you stay focused on what it is that really is your path, you know?
Absolutely, absolutely. That's good things for all of us to remember, because my generation has a lot more of these battles to fight too. Um, so your practice, I spent a week with you in your practice, and saw some really interesting cases. Met your secretary, who I could, you raved about her, and I could tell how good she was and how much she added to your practice. And I've heard both things. I've heard people say, "Oh, you don't need a secretary; it's just an extra set of bills." But then seeing you and how much she helped your practice, I can see definitely how advantageous it would be to have one. Um,
You probably didn't know this, but I didn't have a secretary for 10 years.
wow.
Yeah. So
And
I was doing it all on my own.
and how would you compare then versus now when you have a secretary? Like, what's
Well,
changed?
financially, if you are really wanting to really cut your costs, you would want to do it yourself.
Hmm.
However, by doing it yourself, you really cut down on the hours that you're freed up to be with people. So it's a kind of a catch. And as soon as I got a receptionist and had somebody answering the phone, then I would get the patient. And often, if I was with a patient and they had to leave a message, then I might lose that person. You might lose a third of the people. They want somebody right away. That's the other thing about being in a small town. Some of my colleagues in Missoula and Whitefish, they might have a 2 to 3 or 4 week waiting list. And that's really wonderful to have a 2 or 3 week waiting list because it takes some pressure off of your back and you realize, you feel that your income's happening and it's security.
Hmm.
However, I have to say that the patients who saw me last week, who needed me last week, and I had, an hour here and an hour there and a few other hours when I walked into the Monday morning and I looked at my schedule, I said, oh, I've got an hour on Tuesday open, I got an hour on Wednesday open, and not on Friday, I didn't. But those people who needed to get in were very thankful for that. You're going to have patients who want to see you right away. And if you want to be a family practice doctor, then it's good to have a little space there for people to be able to get in.
Yeah, yeah. I mean, your secretary, your receptionist secretary, she's integral to that. How did you go about finding her? I mean, it sounded kind of lucky, but I wonder if there's anything that you could share besides luck that it would take to find the right person to help your practice like that, or is it just luck?
I think that you have different people that work out really well,
Mm.
and then they move on and have a different life experience and maybe move away, and then you interview other people, and it's kind of a crapshoot. You try them out, and a lot of times it doesn't work. I've been stole from. I've had to call the cops and have to go through a whole thing with that. And I've had lots of different experiences. But right now, I just feel so blessed. And I can't tell you how much more relaxed I am, not only during my work, but at home, going home and not taking my certain things with me. I know things have been handled. She's a troubleshooter. You look for somebody who um, you ask them, are you good at using resources, or how do you um, use your resources? Or you might say, if you might give them a problem, you might in the interview you might say, let's say you have a scenario, and then you look at and you ask them, how would you figure this out? And then so you take a look at maybe their uses of any kind of resourcing is the most important quality, really.
Okay.
And also, of course, is they're pleasant, how pleasant they are. When
Yeah.
you talk to them on the phone, what did they sound like on the phone?
Yep.
Could you feel a smile on their face when they were talking to you on the phone? And because that brightens up their attitude. And
Hmm.
so, because your receptionist is who people see and who people interact before they even get to you. And they are very, very important people. And you need to pay them quite a bit.
I'm sure she'll be glad to hear that if she hears this interview.
Yeah, she's going to listen to this, I'm sure.
Awesome. Yeah, she was great. I mean, it was interesting. I mean, I could tell that you had a chemistry that was like you didn't even need to speak. To
Mhm.
have that, I can just see, was so so
And you'd think
helpful.
that you'd want to find somebody like you
Hmm.
to office. However, I'd have to say that she is not like me at all.
Interesting.
She's a lot calmer and chill, and so she has that effect on me. The way that we are alike, though, is that we both have a tendency to take things from A to Z. And any receptionist that I had working for me that wouldn't take something from A to Z was that became a problem.
By A to Z, you mean follow through to the end?
Follow through.
Follow.
Everything has to have follow through because you can have a lot of things hanging. And a lot of times if she's somehow sick and I can't get anybody to fill in for her and I have to cover her job too, her job is, I think, harder than mine at this point in my practice because now my practice is a little easier. It's hard when you first start in your practice. You don't know what you're going to do with people. You have absolutely no idea. Somebody sits down and you have no idea who's going to walk in the door,
Yeah.
you
Yeah,
know?
you'll probably you end up seeing the first of everything, to start with, and it's like, what do you do? Yeah,
Yeah. Or
yeah,
like the case I was telling you about certain things. Oh yeah, I remember seeing that, hearing about that in pathology 25 years or 27 years ago. And I saw my first case.
yeah,
Um, you're gonna always have that happen. But as years go on, you see the same thing, like sinusitis, gastrointestinal problems. You see the same things coming in quite often, and you kind of sit back, and it's easier. You breathe easier and you relax with it, and you enjoy it.
yeah, absolutely. Would you talk maybe a little bit more about those first years and how you dealt with kind of that uncertainty? Because a lot of my colleagues, I mean, I'm in my second year of Bastyr, and I'll be in those shoes shortly, or fairly shortly. Um, how do you deal with that uncertainty when you're just starting out with your practice? Do you just power through it? Have
Well,
have some mentors.
when I first graduated, I got invited to join the practice of Jack Hins. He was over in Champaign, Illinois, and he actually kind of wanted me to take over his practice. And it was an unlicensed state, and I saw a lot of patients. And so um, it was actually a good opportunity because it allowed me to sort of shoot from the hip at times. Um, so sorry about that noise there. So it's allowed me to sort of, because there were so many people, I was able to have a practice at being able to really shoot from the hip
Yeah,
and use more of an eclectic, holistic kind of approach where I would use a constitutional homeopathic remedy. I would use an herbal complex, and I would talk to them about their diet and nutrition. And so it was kind of it's really nice if you can practice with somebody else at the beginning because it offers you more patience
hmm
to really kind of dive in there and get going on it. I really think it's nice at the very beginning to practice with somebody else.
right. Okay, and then you have that person to kind of there to consult with, and when you need help,
Absolutely,
talk to.
yeah. And
So,
you too, and they're asking you questions, and there might be something that you know that they don't know,
right,
and which kind of gives you that encouragement that, hey, I do know something. And so it's really nice to have that camaraderie ship at the beginning.
right. Um, let's see what else here. So your practice, when I chatted with you, you used a lot of homeopathy, fair amount of herbal medicine, and also some physical medicine techniques. Can you talk maybe some about how the way that, and then also some counseling too. Can you talk some about how your treatment modalities that you use have evolved over time, and what you do use? Um, did you because I know you started off just doing homeopathy. Well, that one
I
part of
did.
your life you did.
I started off um, primarily just doing homeopathy. Like when I was working in the clinic in Champaign, I would add a few other things because that was the protocol that he was doing. However, when I had my practice in Marquette, Michigan, which was simultaneous, I would drive down to Champaign and work there, and then I worked in Marquette. For 5 years, I pretty much just wanted to focus on homeopathy. I had studied it really intensively, and I wanted to make sure that I knew I was getting it and doing it well. And I also was a classical homeopath, so I kind of had this feeling that that would be all I would ever do, sort of feeling. Um, but it seemed like about every 5 years, 3 to 5 years, I would add another, study something else really intensively and add another component. Do you know what I mean? And
Yeah,
then all of a sudden it all just kind of gelled and I'm doing it all. It's pretty eclectic what I do. And I like to go in from different angles. Like with homeopathy, you're working with the energy medicine. I personally do a lot of strain counter strain, which is a physical medicine. It's something that a lot of physical therapists use, but it was developed by an osteopath, and I really appreciate that treatment modality, and I like you want to do something that you where you're getting your hands on people and you're actually touching them,
Yeah.
uh, besides just a physical exam, but also that you're when they walk in pain, they leave feeling better.
Mm, right.
That that's a very important thing to feel that you can help somebody leave. First visit, they walk in pain. How can I help them in pain? Um, Sometimes I might give them a homeopathic remedy that I really am thinking is the right remedy, get them on the table. Maybe sometimes I give them a high dose of magnesium citrate before I work on them on the table because they are just so tight and so depleted in that way. But you might want to right in the office give them something so that they actually have a healing experience the very first time that they're in the office.
Yeah, that makes sense. I mean, I hate to say strictly from a business perspective, but it's like if they leave feeling better, they're going to want to come back and they're going to believe that the medicine works. And then,
Yeah,
I mean,
yeah.
they'll feel better too, which is, of course, the whole point of,
And that's a
helping
tricky
somebody.
thing with
So,
being a practitioner is often we feel that people don't give us a lot of time to get them better, and it feels kind of unfair. I mean, you've been to these medical doctors for like 10 visits and taken all these drugs, and we have these layers to peel off, and it takes time. So
right.
that's why, and it does take time. So that's why it's important to have a few things that you feel really confident with that very first visit you can work with that. And like you said, the counseling too. It might just be somebody that will listen to them.
Absolutely. Absolutely. We talk a little bit about strain, counter strain, and then we can move on to some of the cases. It's something that I don't think is taught at Bastyr. I've never seen classes on it, but I saw you use it to really good effect with people. Like you said, having them leave with less pain. I saw a lot of people leave with a lot less pain, so it was working. So would you just talk a little bit about how you discovered that technique and kind of what it is?
Oh, well, I was introduced to it by a colleague in Missoula who was
Okay.
bringing in the Jones Institute for us to do training. And I haven't really even done all the trainings. I did quite a bit of body work before I went to naturopathic school. Did some massage therapy. It was back before we even had massage therapy was even licensed in the States.
All right.
And so I did quite a bit of that when I was going through school to make money to get through school. And so I've always been kind of a hands-on kind of person. But when I started doing this technique, it really gelled. It really made sense that if you overstretch a muscle or a tendon, that it's going to want to contract up because it's trying to protect itself. And so when it tries to contract up, what you want to do is you want to, just like homeopathy, where the like cures like, if the body's trying to contract into a direction, then and you discover painful trigger points uh, through your palpation, discovering where that contraction's happening, then if you continue allowing the body to contract farther in that direction, sort of like the simillimum with homeopathy, if you allow the body to go farther in the direction it's trying to go to cure, then you're actually releasing that tightness and that spasm and that uh, um, the discomfort and the malalignment, if you will, if it's in the vertebrae, because of that contraction in that certain area. Does that make sense?
It does. It makes sense. It makes a lot of sense. Um, Great. Well, let's. Thanks for sharing all that information with me about your practice and techniques you use. Is there anything else that I didn't ask you about you'd like to talk about as far as that goes, or we can just jump into some of the clinical stuff?
No, I think that's whatever you feel like would be useful there.
Okay, great. There were some really interesting cases that I saw. We'll talk about a few of them, and then there was one more that we talked about earlier in our pre-interview that I'd like to talk about too. Should we start off with the one that we talked about in the pre-interview? And what about the autoimmune?
No, no, I think we should start on something simpler.
Something simple. All right, we'll start with something simple.
A little
Let's
simpler.
go with the stuck stitch and the homeopathic. You
Oh,
talk
okay,
about
yeah.
that. There's something I guess fairly simple. So there was an impacted stitch, right, that you gave a homeopathic remedy for.
Right. Yeah.
Um,
It was a kind of a side complaint from an old surgery that there was a stitch that was trying to work itself out, and there was a little bit of a felon, if you will, a little not really abscessing, but it was definitely you could tell that there was an infection around it, and I just mentioned to the patient, hey, let's get you on some silica and high potency to get that to your body to push that out. Silica at low dose will reabsorb, and at high potency, it will push a
mm,
foreign body out of your body. It will help your body to push that foreign body out of. So what she told us a couple days later, you were here when that happened, so that was kind of neat for you to see because while your first day you were here is when we gave her the silica, and then we checked in with her later on that week, and indeed the stitch had come out.
yeah, so it's so cool. It's so cool. It's still so cool to for me to see homeopathy work because I come from a science background where everything's molecular based, and
Mhm.
it works. It's like we in my homeopathy classes we just saw a video on how it worked with these cows, and it's like how do cows know they're getting homeopathy? So anyway, it's
Well,
homeopathy is fun to see work.
when I was practicing in Marquette, I had a lot of patients over in Wisconsin, and I'd actually go to over to Antigo, Wisconsin, and treated a lot of horses with homeopathy, and it really gelled that whole because it was early on in my practice that it gelled that whole thing for me that it's not the placebo. Babies, horses, dogs, cats. It's it definitely works. And so it's really important as a student to actually I didn't believe in homeopathy when I started naturopathic school, but I ended up with pneumonia my second year, and I had an aconite experience where I thought I was going to die, and they gave me aconite, and my lungs completely cleared within like 30 seconds. They went from being really having all this noise to not having any noise at all. And knock on wood, I was sick a lot before that. Every winter I'd have bronchitis. And since then, 28 years ago, knock on wood, I never get any upper respiratory illnesses. I was treated with tuberculinum to treat my underlying constitutional weaknesses, and I
Mhm.
was given constitutional remedies and a lot of so I had an experience. I guess that's what I'm trying to encourage you to have the experience in your own self of homeopathy and how it can change your life.
Yeah, absolutely. Would that be the key then you would say for you and for the listeners to get to know homeopathy better and to get better at it would just be to experience yourself, or should you read books? Like what was the key to you to get better? I mean, what experiences led you to um,
Well, luckily I was only a second year student when that happened.
okay.
So that part of it now was handled. I understood that it worked. So
Right.
I didn't have to keep experiencing that for myself. And now my goal was at that point was how am I going to re-experience this with people? How am I going to or animals? How am I going to watch this amazing process happen where, we have these deep cures that are sometimes very quick, very, very quick. And so so it was, eventually you just got to let go of, does it really work? And you have to
Hmm.
dedicate yourself to learning the remedies.
Right.
And so by the time I was a third year student, I was really dedicated to learning the remedies. And that's what I'm talking to you about as my preceptor.
Right.
Am I the preceptor or are you the preceptor? The
Yeah, I was preceptoring with you. Yeah, yeah,
Yeah. Okay. Well, I guess I'm the preceptor and you're the preceptoree.
Okay. Yeah, I'll take
Okay.
it.
So that's what the summer I was writing down, different remedies I wanted you to practice to learn, but
Right.
also to learn keynotes of each one of those remedies so that you can spot it just like that. So if you were in a situation where you had to treat a lot of people all at once, that you could come up with a remedy here and there. You know what I mean?
Yeah.
Very quick.
Yeah. We're going through sort of one remedy at a time. I'm in homeopathy one right now, and it's we've done aconite, we've done opium, we've done a few others, and it's interesting. I mean, there are the keynotes for each remedy, and right now my approach is just sort of to memorize those, and I don't have a better way right now to do it. And maybe that's all it takes. But once I get in the clinic and start actually applying those to people, I think it'll maybe stick more. But um,
Mhm.
yeah.
Sometimes it's nice to have a little face to a remedy when you're learning it.
Mm, okay.
Just have a friend, like have it become a friend. Like, you have a good friend and she's a gal and she's got hair down to her waist and a braid, let's say.
Yeah.
So if you see her from the back, you recognize her just like that.
Mm-hmm.
But if she got her hair cut, you wouldn't really recognize her because she's kind that braid is her keynote. Do you know what I mean by that? It's like
That's her signature. That's
that's the
who
thing
she
that
is.
you recognize. That's how you recognize her. And so you want to have ways that you recognize remedies, like aconite, you just studied it. So it's great that you went over it in a big way and learned all the different components of it. But a chronic aconite person who walks in the door, they've got fright. They've got fright. And so when you see fright and fear and angst, anxiety from a fright, you think of aconite first. I mean, you think of it, you don't rule out any other remedy, you keep an open mind.
Mm-hmm.
It's like, okay, aconite's going to be in there as one of the remedies I'm going to think about in this case.
Right. Now that brings us to this other case of the you had a patient who, as part of her job, was went to a house and guy came out naked with a gun, and he didn't shoot her luckily, but she was left with some pretty serious issues after that.
Mhm.
Can you talk a little bit about the case and how it was treated? I'm not sure, was that an aconite case or um,
Aconite has been very successful in that case.
okay.
However, that fear has been brought up has also brought up, that incident has also brought up some chronic issues such as um, a, uh, a suicide in her family where unfortunately she was very young and she was the one that ended up um, uh, uh, discovering. And so what I did is I referred her then to my husband, who's a therapist, and she's been working on some of those issues as well. However, aconite has been very useful to get her back out in society. She's like this summer she came in. Maybe it was when I saw you. Was she going to the fair that weekend?
Hmm.
Oh,
No.
well, anyway, she wanted to go to the fair
Okay.
and she's back in and she's like, I want to go to the fair, but I know I'm going to freak out there. And I said, well, have you been taking your aconite or are you, because I didn't give her a high potency yet. I've been giving her a low potency.
Okay.
And she said, oh, I forgot about the aconite. And so she took the aconite that afternoon and she and her husband got in the car with her grandkids and went to the fair. And then I saw her the next week and she said she had a wonderful time and she was fine.
Wow.
So, but aconite is so useful for that kind of thing. Now, will I finish it with a higher potency? I will, but I'm really not wanting to do that yet. I know that everybody does homeopathy differently, and so, but I do have her on Brain Links, which has a lot of the neurotransmitter amino acids and that is very useful for her as well. And she's probably focusing way better than she is focusing better than even before she had the incident
Yeah. So
because she's getting the
so brain links is just it's basically food for the brain. Is that way one way we
yeah,
put it?
it
Okay.
is. And you've probably heard of Empower. Have you heard of New Hope?
Uh, no.
Well, there's a company called New Hope. I heard about him through Jonathan Wright, one of his lectures. But New Hope is really for people bipolar and other emotional disorders. They get on this Empower and Empower Plus. Those are two of the different uh, formulas. And Brain Links is very similar. However, Brain Links is half the price.
Hmm.
However, unfortunately, it has whey and egg albumin in it. So if I have any patient that has any inkling of an allergy, then I have to give them the Empower, which is more expensive. But they both work equally as well
And
for
you would give those in what types of cases?
anxiety, bipolar, depression, adjustment disorders. Like this woman, really, you could say that this was an adjustment disorder. How does she adjust to new situations when people, like their husband leaves and they're not chronically depressed, but they're going through a change. They have a death in the family. These are adjustment disorders.
Yeah, yeah. Um, what are the most common types of patients that you see, or is it, is there one, or is it just such a wide variety being a family practice and um, you know,
It's a very wide variety of people from all ages and both sexes and every kind of walk of life. Wealthy people, poor people, white people. I happen to live on an Indian reservation, so Native
mhm.
people, um, and just anybody and everybody you'd see.
Yeah, yeah.
I have to say, I have to say that I have the cream of the crop of people who come in here. I have a really good friend who's a nurse, and I have a couple friends who are medical doctors, and I know that they have a harder time in their practices because they do not see the cream of the crop like I do. People who come in to see you will be people who are at some level wanting to take more of a respectful approach to their life, and
Interesting.
they're asking for how to do that.
Right. So they come in with a certain level of openness.
A certain level of openness, and they're not coming in for an OxyContin
Yeah.
prescription or some sort of drug script that they uh, you know there's less of the using type experience and
Absolutely.
more of the love, a lot of love.
That's awesome. Let's talk about a couple more cases, and then I wanted to talk some with you about listening and how to really listen and pick up on some clues when you are interviewing a patient. But there was a case of prostatitis that I saw when I was with you that you treated was it using vaginal suppositories? And I thought that was really creative. Um,
Yeah, he had a chronic prostatitis that he had been given antibiotics for by medical doctors periodically, never cleared up. And I I'm thinking, what better way to get right to the prostate is to put a suppository in the rectum.
hmm
And so we did a culture too. I can't remember the culture because see, when you saw that patient, he had already had that. That was just something we talked about that had happened in the past.
Right.
But we just used the Hydrastis, Echinacea, Thuya suppository from Wise Woman. That I think it's their number two, but it might be their number one. And just had him use that nightly for a while, and then every other night for a while, and his symptoms went away, and he was fine. We
Yeah,
cured him.
that's all. I love that story just because it showed me a lot of like just creativity. It's like the prostate has a poor blood supply, and the antibiotics weren't working. So it's like, how do you get there? And it worked. When it comes down
Yeah,
to it, it worked. So
yeah,
fun,
you got to be creative.
fun little clinical tip there for all the listeners. And then to finish off the cases, let's talk about the girl who I think you said she's 12 and she has, is it four autoimmune diseases?
Yeah, she just presented last April with her mom brought her in because they were going to take her spleen out. she was diagnosed with, she was just almost turning 13 when she came in, and her mom brought her in because they wanted to take her spleen out because she was just diagnosed with idiopathic thrombocytopenic purpura, which you'll learn about this year, and which I had heard of. I remember it from pathology, but I had never seen a case of that.
Hmm.
I'd heard of, I'd actually had patients who had it, but I didn't treat those patients. So
Right.
this is the first active case of that. And and so that was very concerning. They wanted to take this 13-year-old girl's spleen out.
Right.
And of course, her parents are going, no, you're not. And the medical doctors go, yeah, we are. Her platelets were falling very rapidly. She had been having um, a lot of bleeding. You could call it menstrual, but it was continual. And she also, actually, when I interviewed her in the history, her main complaint basically was the fact that she had a lot of stomach pain. Okay, and
Okay.
then and a lot of stomach ache, whole stomach achy, loose stools. And so what happened was that in asking the mom and the girl more questions, and then calling to my office manager and having her run out and get the lab, because a lot of people don't bring their labs in, and then you want to have that lab that first visit because you can really hit the ground running. We
Right.
discovered that somebody had the at least had looked at what her thyroid. They did intensive tests on this girl, and they found out that I saw on the lab that she had Hashimoto's thyroiditis as well. So here's a girl that has 3 autoimmune diseases presenting here. She's just turning 13. Her thyroid is being attacked, her spleen's being attacked, and her pancreas was already attacked a year and a half before that. And then she's got the stomach issue. So I did a little research that night and found an article that was associating H. pylori bacter. The research was actually out of Japan. I had that in my notes. At H. pylori bacter with idiopathic thrombocytopenic purpura. And I mentioned that to the mom, and the mom said, oh, yeah, I saw that too. Because, of course, the mom's going to be researching. And I mentioned that to them. She said she mentioned to the medical doctor, but evidently, because it wasn't his idea, he wouldn't run that test. So I ran an H. pylori bacter, and it was positive.
Wow.
So then there was a fourth illness this girl was dealing with, which was really and her sugars were all over the place. They were having a really hard time controlling her sugars with with the normal pump and the normal protocol that you would have for type 1 diabetes. So I educated the mom about autoimmune. And I asked you about autoimmune. Did you learn about the components of autoimmune? And you had learned some of that in your first year of naturopathic school. And so I talked to the mom and the girl about how we're going to have to work with her immune system and getting it so that it's not attacking itself. So immediately took the girl off of gluten, which is
Okay.
in terms of Hashimoto's, you always want to take a person off of gluten.
So you see Hashimoto's and first thing gluten gone.
Right, because there's
Okay.
quite a bit of research that shows the protein of the thyroid is very similar to the protein of the gluten.
Hmm.
And so if somebody has an issue with gluten, then they can attack their own thyroid. And as soon as we took her off the gluten, her stomach symptoms improved. Okay, because you got to remember that was her chief complaint.
Right.
Even though really the seriousness was really her platelets falling and do we need to take her spleen out? Okay, so she got better right away. Do you want me to tell you all the things I put her on?
Yeah, I'd love to. Just to kind of, because she's such a complex case, I'd love to know what it took, where she's at now, and what it took to get there.
Okay, well, first off, you want to study the nuclear factor kappa beta protein. Okay, because that causes a cascade of events on the cellular level that will cause inflammation and autoimmune. So you want to study that, and basically turmeric, boswellia, basil, these kinds of things will help to dampen the effect of that nuclear factor kappa beta protein. Okay, and which signals your DNA or a person's DNA to make more inflammatory uh, um,
Protein.
cytokinins and such.
Okay.
So now, what gives stability to the nucleus, to the gene itself, is vitamin D. So you have to have vitamin D in place. And I'm sure I checked her vitamin D, and of course, if it was low, I put her on it. I believe it was low. I'd have to look that one back up. I put her on deglycerated licorice, obviously. I asked the mom, do you want me to work with this H. pylori bacter without antibiotics? Because I feel like this girl's been through so much. I even think giving her some antibiotics. I was kind of hesitant to recommend antibiotics, and so I wanted to do it without it. And the mom really wanted that too. So I put her on SF734, which is bismuth and some thorn. It's got all of the things in it that will help to heal the stomach and also kill the H. pylori bacter.
Okay.
And I put her on a probiotic, a real high potency probiotic, and I put her on boswellia, which is frankincense, which is used for inflammation.
Right.
I gave her phosphorus homeopathic 30C due to her constitution, which, if you saw the girl, she is beautiful.
Mm-hmm.
She's absolutely beautiful. And the bleeding,
Mm-hmm.
the continual bleeding. And, the phosphorus, there's a point where you get in your practice where you feel it. You feel the remedy.
Yeah.
This is a phosphorus case. She liked to eat. There were a few things, she liked spicy. She ate ice. She liked cold drinks. She likes salty. She drinks a lot, but she's got type 1 diabetes.
Right.
So phosphorus is a big remedy for type 1 diabetes.
Okay.
So I gave her a 30C. And then, unlike what I normally do as a constitutional homeopathic prescriber, I did alternate that with a Ceonanthus 30C. Because Ceonanthus, if you look it up, is a big spleen remedy, and I wanted to give her that. I wanted to give her Ceonanthus.
Right.
Um,
How do you do two remedies like that? You just say take one day, one the next?
yeah, probably for her, I had her do one in the morning and one at night.
Okay.
Okay.
And do you just single dose those, or do you have her take the 30 Cs for a period of time?
Yeah, 30C repeated, because it's an organic situation that I want to give as high a dose as possible to have, a real strong energetic effect, but I want to give it low enough that there's going to be a physical thing.
Okay.
Okay, so, everybody learns homeopathy differently. And some people, when I went to school, they were just giving high potency, and then I learned from Asiaga in Argentina, who's a low potency, starts on low potencies and works up.
Okay.
And it's not uncommon that I'll start at 30. I also gave her something called Thyroid Helper to help to support her thyroid gland, because I really didn't want to see her become hypothyroid from the Hashimoto's, which she wasn't hypothyroid. And still to this day, she hasn't become hypothyroid. I just checked her thyroid the other day, and that was like 6 or 7 months ago. I also gave her some they're homeopathics that are really low potency from a company called HVS. And that's something I learned from a practitioner 25 years ago. and I like them, and I gave her organs and systems and support because this girl needed as much support as possible. And these are like mitochondria kind of supporting things. Okay. She did a lot better right off with that protocol. Like, like really a lot better. And but I have to hand it to her because she went off gluten, and for that age person, it's very difficult to do that. But
Right.
she did a so the first time I saw her was April uh, April 1st. By April 12th, she came in and I said, "How's your stomach?" She said, "It's good. I haven't had any stomach aches. Um, I am gluten free," she said. And when I palpated her abdomen, it was a lot less tender to palpation. It was really tender the first time.
Okay.
It was so sore. And so the platelets were continuing to drop. Um,
So the platelets were getting worse. Is that
Dropping.
sorry?
Yeah, yeah, they were still dropping.
Okay.
And then I saw her a week later, and she had inadvertently went to the movie and had some candy that had gluten in it and got really sick. Of course, candy and a type 1 diabetic, but she was eating, she does eat some things that she shouldn't eat. And then she just does like a bolus or manages that. She was still on the pill. I didn't take her off of it. And that week, they did platelets every week for her. At that week, her platelets had leveled out to 71,000.
Okay.
Okay. They weren't going up or down at that point. And then, let's see, and then on May 10th, the platelets started going up at 84. Oh, and I put her on oregano.
Mm.
And why did I do that? Because I felt like she needed it. For everything. I just felt like oregano capsules would be really good. And oregano and Originon, which is oregano, the Latin name for it. Originon and cinnamon is used herbally to stop bleeding.
Huh.
So you can give it as a tincture, but then I thought she's got the H. pylori bacter, she's got bugs in her gut. Let's give her oregano capsules, and because it would be easier for her to take as well, because we have compliance issues too. And so she started taking the oregano, and well, anyway, I can bring
Okay.
you up. I just saw her recently.
Yeah. What's her current situation? How's she doing?
Um, she her by the way, her platelets went up over the course of the early summer, and they stopped talking about needing her platelets by June 14th were at 123. And I had given her, and then now we needed to start thinking about how we're going to wean her off of those birth control pills. Okay, so I gave her like Simplex Lap and Ovax and some things for her and chlorophyll. And then her mom said on July 19th, she said, I had quoted her in her chart, on July 19th, she goes, "I feel like a normal kid for the first time in a long time."
Wow. That's amazing. So here's a 12-year-old that whose life had been just severely impacted by four major problems, and
Mm-hmm.
there she is, and she felt normal. Um,
Mm-hmm.
and so that was in June. Here we are. Did you say you saw her last week?
Yeah, I saw her on the 18th of October,
Okay.
and she weaned herself off the pill.
Oh,
During the summer, she didn't want me to take her off. She didn't want her mom. She said, no, I don't want to. However, what she did is she started, whenever she would stop taking the pill. And then if she would bleed a little bit, she'd take it the next day. And she just sort of weaned herself off of it. And then eventually she told her mom that she had weaned herself off. And with the protocol that we were doing, she didn't start bleeding again. she's just having a normal period once a month now.
Wow.
Now I have to
What is bleeding
say,
every day? In which, of course, severe anemia. If you're bleeding every day, you're gonna have anemia.
yeah, she was anemic when she
Very
came
much.
in,
Yeah.
sure, yeah. But they were trying to hold it back with the birth control. It's an interesting case, and it's one of those things where it can be overwhelming at first when you see it and you go, what am I going to do? What do you do here? But you just sort of piece it together and you look at different aspects of what's going on and you see what are the common threads. And we have so many tools. I mean, we have so many more tools than the medical doctors. I
I
mean, they,
know. That's the exciting part. It's like you don't just have pharmaceuticals. You have
yeah,
yeah, all
we
this.
have so many tools, and it's really an art how you want to put it together.
Hmm.
It becomes an art form, but there's a common thread that we all share in how we practice as well, and that is that we trust that the body wants to heal itself, and we utilize nature to help it to get back to that state of balance that it's always desiring to go in. And
Right.
whenever you're treating a patient, when you have your hands on that patient, you're in your mind's eye through your heart. You feel that in that person, and you communicate with that person, even non-verbally, that you understand that their body desires that, and you always stay on that side of the healing.
Right. And giving the patient that space and that intention is there's a lot of power in that itself. Yeah.
Absolutely, because they're going to feel that. They're going to feel
Absolutely.
that from you.
Yeah, my first naturopathic visit, I was listened to for 2.5 hours, and had never been given more than 15 minutes to share my story, and I left feeling like I had been given some great treatment because, I hadn't been, I'd just been listened to, but, when you're sick and you're living with something every day and not feeling well, like just to have somebody to share that with, there's a lot of power in that. So,
Mhm.
um,
And can I make a comment about that too, Matt?
absolutely.
Um, we saw an elderly couple too come in when you were here, and there, she was injured. Her hip was injured, and I wouldn't have known that it was from having sex, except for the fact that I caught it in her husband's eye in that
Yeah,
interview.
yeah, I was so amazed you caught that because I didn't, but
Right.
you saw it in his eye. You said.
And I wanted to point that out to you
Mm-hmm.
as a student, because if you're amped up on coffee or caffeine and you're wanting to get on to the next thing, and you're freaked out about what you're going to do next or whatever, you're going to miss those kinds of things. You're going to miss those little looks. And when he just had this certain look in his eye, and I said, "What?" And he said, "Well, I've been a little rough." you know,
Mm-hmm.
hip, pulling her leg out. And I'm like, okay, well, um, now we know where the injury happened and how it happened and what the motion of it was. But we also needed to do some counseling about what they were going to do about this, you know, and he was so relieved. She was really relieved to be able to talk about that, because how are they going to talk about that really? And
Right.
so then we can open that up, and the couple can feel comfortable talking to you about very intimate details of their life. But if you don't open it up and you don't notice and let them talk about it, then it's not going to happen.
Right. Right. So it's about how do you intentionally give them that space, or is it something that you've just been doing for long enough now that it's hard to maybe describe how you do it? I mean, like you said, if you're amped up on coffee and you're running around, you're not going to hear it. So maybe grounding yourself, is that
Yeah,
just keeping yourself
well,
grounded?
I think those years of being a classical homeopath has really been helpful for that, because you
Mhm.
do sit back and you listen and you observe, and it's good practice.
That's a great tip. Yeah, that's a great tip. Um, well, I think that might be it.
That's great.
It's been an hour, and I'm sure you have somewhere to be, and
I'd
uh,
like to go to yoga.
Well, I'm gonna let you go. It was great talking to you, and I would love to talk to you again sometime. Hear some more of these interesting cases, and again,
I would be, I would be more than honored to be interviewed again.
thank
So,
you, Dr. Carr. It was great talking to you, and yeah, thank you so much. Again, we'll
all
talk soon.
right. Okay, we'll see you.
All right, take care.
Bye.
Bye.